Hey everyone, it's Wednesday, time for Wisdom Wednesday. Today I'm going to give you a little bit of a breakdown of some of the information that we started getting last week at my hormone update meeting, which was really about brain health and focusing in on Alzheimer's disease. So we talked last week about how some of the research had really been fraudulent, and now I'd like to kind of turn it over to where we really are starting to see the focus. And we'll talk a little bit about just how the pathophysiology of Alzheimer's really seems to be trending in terms of its research. And then as the weeks go on, I'm going to really dig into the data of the things that, of course, the things that are, I guess, closest and nearest and dearest to my heart, which is hormonal therapy, which seems to have a lot of great benefit, and we'll dig deeper into how that really seems to be of great benefit, particularly as we're aging. So we know that because of the fraudulent data, we really want to focus in on some of the things that are truly real and beneficial as far as understanding the pathophysiology. And we know that we see loss of brain cells and deposition of amyloid plaques. There are neurofibrillary tangles, tau proteins. These are all scientifically proven areas of concern when we've looked at the brain. There's increased activation of pro-death genes and signaling pathways that impair energy metabolism. We see mitochondrial dysfunction, chronic inflammation, oxidative stress, and of course DNA damage, which can be quite prolific when we see the destruction that's happening with Alzheimer's disease and the loss of cognitive benefits that patients, we just see significant loss of cognitive abilities. So currently what we're seeing in the growth of literature is pointing toward insulin resistance and insulin deficiency as mediators of the type of Alzheimer's disease that we see in this type of neurodegeneration. And many people are now calling the aspects of Alzheimer's disease type 3 diabetes, and it's really just a brain issue with insulin resistance. So let's look at that a little bit more, because diabetes causes insulin resistance, oxidative stress, and cognitive impairment. This is something that really is similar in what we see with Alzheimer's disease. Disturbances in the brain, insulin and insulin-like growth factor, or IGF, could be the culprits and account for much of the pathologic problems that we see with diabetes and with Alzheimer's disease. Around 2005, the research that primary brain insulin resistance and insulin deficiency mediate cognitive decline, really, this type of research exploded. And the idea was fueled by the evidence that this tau gene expression is regulated through insulin and insulin growth factor signaling pathways. So there's a deep connection between what we see, the deposition of tau, neurofibrillary type issues in the brain, as well as the amyloid plaque. And we notice that there's increased risk of developing mild cognitive decline and Alzheimer's disease in patients with type 2 diabetes. We see progressive brain insulin resistance and insulin deficiency in Alzheimer's disease. We see cognitive impairment in experimental animal models that have diabetes, type 2 diabetes, and obesity. We also see that there's neurodegeneration and cognitive impairment in experimentally induced brain insulin resistance. And there's shared molecular, biochemical, and mechanical type abnormalities in type 2 diabetes as well as Alzheimer's disease. So there's great correlation between the two. And it's estimated that the incidence of Alzheimer's disease is going to double every 20 years into the future. This is really concerning. We know that study after study after study provides this strong evidence that Alzheimer's disease is intrinsically a neuroendocrine disease caused by selective impairments in insulin and insulin growth factor signaling pathways. And we need to be able to dig deeper and understand this more and address it from this perspective, not just look at the end products of what we see with Alzheimer's disease, i.e. amyloid plaque, and try to get some type of antibody toward the plaque. That is just a result of the disease process, but it's not what's causing the disease. And so it's not just the end results of insulin and insulin growth factor type issues, but it's accompanied by this inflammation and the oxidative stress and the DNA damage and the mitochondrial dysfunction. All of these contribute to this progressive nature of Alzheimer's disease. So we're going to look at this as we dig deeper in the next few weeks and look at ways, how can we really affect this? Obviously, we can do much from a nutritional standpoint as far as insulin resistance is concerned. Simplest thing that we've talked about over the last several months and over the last year or two is just fasting, which can increase our ability to be more sensitive to insulin and reduce not only insulin resistance in the body, but in the brain as well. So I know this is kind of nerdy and sciencey. I thought maybe you might enjoy getting ready to see the early sunset here in Santa Fe. This is our last day here. We'll be coming back to Dallas, but thought you might enjoy this today. In addition to just all the nerdy talk about Alzheimer's, but we're all affected by it. I think there's not one person at our meeting this past weekend that didn't raise their hand when asked, do we know someone with this disease? I think we all have been impacted, and as a result, we want to really look at this in a way that we can truly decrease our risk, because that's the best thing that we can do, is just lower risk in the future. So we'll continue to talk about this. Hope you all have a great day, and we'll talk again next week.